So today we will be talking about antibiotics. Antibiotics are medical drugs indeed, but they have potentially life-threatening side effects.
Tyler says. So yes, our guest today is Miss Pumpa. Was I supposed to say Tyler says?
No.
Oh, okay.
And I just have to walk right in front of the thing. Yeah, that's it. You should have me come in from the other side. Just saying.
No bother since it's really common.
Should I move closer to Blake?
Yeah. Alright, where are we? So what are your thoughts on antibiotics?
Well, they can be a very good thing because they can get rid of bacterial infections. Unfortunately, they're overused, and so stronger and stronger bacteria are developing, and it's getting harder and harder to fight those bacteria with antibiotics. It's creating superbugs. And also, antibiotics can kill good bacteria and throw your whole system off balance. So they have good side, bad sides, and they have a lot of side effects, which can be negative.
So I guess I don't need to ask what antibiotics do because she already said.
We'll ask it anyways.
Okay, what do antibiotics do? So.
You asking me?
Yes.
Well, they kill bacteria.
Mm-hmm. Antibiotics target microorganisms such as bacteria, fungi, and parasites. However, they are not effective against viruses. If you have an infection, it is important to know whether it is caused by bacteria or a virus. Antibiotics are prescribed sometimes for the common cold or flu, and usually the go-to drug in emergency rooms around the world because of lack of information on the patient. Over 50% of antibiotics prescribed in the U.S. are not needed. They should only be prescribed for bacteria-borne diseases. But they're often prescribed for the wrong type of diseases, so remember the following as you do I need antibiotics. Gospel. Sniffle, sneeze, no antibiotics, please. If you have a viral illness, such as the common cold or flu, except that there isn't a drug that will cure it. Be mindful of how you discuss your symptoms with your doctor. Physician surveys find that doctors are more likely to prescribe antibiotics when patients use diagnostic language, such as, I think my son has an ear infection, or I think I have strep throat, compared to when they describe their symptoms. My son's been grabbing his ear and seems miserable, or it really hurts when I swallow. Even if you're not expecting or hinting around for an antibiotic prescription, your busy doctor may misread your intent and give you one anyways, all in the name of patient satisfaction. Ask about alternatives. If your doctor says, let's take a wait-and-see approach, ask about alternative remedies and be open to trying them. Don't go on a hunt for a willing accomplice. If your doctor sends you home with a recipe for chicken soup instead of a Z-Pack, yes, you'll likely find it fairly easy to find another doctor willing to write that script, but resist that urge for a quick fix. See tip number 1. Ask questions. If you're handed an antibiotic prescription, don't leave without having a discussion about it. What criteria your symptoms meet to warrant the antibiotic, the possible and common side effects, what you should do if you experience a reaction. Be sure to completely understand the doctor's dosing instructions.
So now I say, according to this nice little script here, that's okay. Our next question is, so how, after hearing what and why should antibiotics be prescribed?
I just realized I'm wearing a green shirt.
I can still see you.
Yeah, but you can see that.
So, are you asking me that question?
Yes.
Well, so antibiotics would be for a bacterial infection, but not a virus such as the cold or flu.
Okay, next question is, do you know the potential side effects of antibiotics?
Feel higher than.
Let me see, you?
Oh, that was me.
Well, a fungal infection for one thing.
Potential side effects include bad rash, bad sore throat, respiratory difficulties, nausea and vomiting, diarrhea, swelling of joints, Stevens-Johnson syndrome, a rare skin disorder most associated with sulfonamides such as Bactrim, retinal detachment, muscle spasms, compromised gut health associated with repeated use of antibiotics prescribed for intestinal, urinary, and
Systemic infections?
Yeah, systemic infections.
I guess they're smarter than us. After hearing the After hearing these, what do you think about antibiotic side effects?
Well, in my own personal experience, I've had a few side effects from antibiotics, but nothing quite as drastic as what you're describing there.
Well, these side effects surprise me because I've been prescribed antibiotics for the same side effects that come from it. There are a lot of pros and cons of antibiotics. Antibiotics kill disease-causing bacteria. According to Microbiology Online, antibiotics are chemicals that aid the killing or inhibiting of bacteria growth through the prevention of bacterial cell multiplication. But antibiotics can kill both good and bad bacteria, and people and diseases are becoming prone to antibiotics. Antibiotics also can save lives. Before the discovery of penicillin, the leading cause of death is infection, which includes pneumonia, tuberculosis, and gastrointestinal disease.
You're welcome.
I didn't say thank you yet, but thank you.
Oh, Blake, you're welcome. You're such a good friend. No, he's not.
I'm not deaf. They can prevent common colds from progressing to pneumonia. A study published in the Annals Family Medicine last 2013 shows. Why does it say last 2013? There's not like a 2013 before that or after that.
How do you know? Were you around then?
Yes, I was.
Maybe you aged backwards, and that's why.
Then
you're
just
so
change
small.
it to in 2013.
Yeah, in 2013 shows that by giving antibiotics to patients suffering from common colds lowers the risk of developing pneumonia. Reports Modern Medicine Network. But the early antibiotics used can affect child development. According to Medical News Today, a study conducted in New York has discovered that early administration of antibiotics in children has led to weight gain and larger bones, and is said to possibly contribute to obesity in later years. And overusing antibiotics can put all patients in nursing homes at risk. Based on a study published in JAMA Internal Medicine, the use of too much antibiotics increases the risk of medicine reactions, allergies, diarrhea, and infection among patients confined in home facilities.
So, as you see, antibiotics can truly give you the best of both worlds.
After hearing this information about antibiotics, what do you think of antibiotics?
I think you have to be really careful with them and really consider whether you need them before taking them.
Yeah.
Good script.
We done?
So today we will be talking about antibiotics. Antibiotics are a miracle drug indeed, but they have potentially life-threatening, side effects.
Oh, so Tyler says, oh yes, our guest today this time is Matt, get behind the screen!
Stay back behind the screen! Sorry.
Bad dog!
Just, sometimes this is totally, like, our real desk. This desk's actually here. That wall's, like, actually real. And, just don't look at my shirt. Our wall talks to us and sometimes moves. It's alright, so.
It's haunted.
Alright, first question.
Do you know what antibiotics do and why they are prescribed?
They help you when you're sick and stuff.
More specifically, shut up, Wall. We're in the middle of an interview. Sorry about that. More specifically, antibiotics target.
No, I'm kidding.
Antibiotics target microorganisms such as bacteria, fungi, and parasites. However, they are not effective against viruses. If you have an infection, it is important to know whether it's caused by bacteria or a virus. Congrats, you're third place in the Lady Crushers.
Yep, third place.
Ooh, that sounds awful.
Here.
Alright, so antibiotics are to whether or no it's caused by bacteria or a virus. Antibiotics are prescribed sometimes for the common cold, flu, and usually the go-to drug in emergency rooms around the world because of lack of information on the patient. Over 50% of antibiotics prescribed in the U.S. are not needed. They should only be prescribed for bacteria-borne diseases, but they're often prescribed for the wrong types of disease. So remember the following as your Do I Need Antibiotics gospel. Sniffle, sneeze, no antibiotics, please. If you have a
Did you get
viral
that?
illness,
Did you get that? If you're sniffling or sneezing, no antibiotics.
if you have a viral illness such as the common cold, flu, or the
We're always
flu,
ringing a bell
except that
now.
there isn't a drug that will cure it. Now he's talking to our cameraman.
It's the wall.
It's haunted.
Oh, wait. Oh, she missed my thing. You need to say her. As soon as we're done with this,
What's
Blake,
on the desk?
get back
Oh,
to
yeah,
it.
all right. Be mindful of how you discuss your symptoms with your doctor. Physician survey find that doctors are more likely to prescribe antibiotics when patients use diagnostic language, such as "I think my son has an ear infection" or "I think I have strep throat," compared to when they describe their symptoms. "My son's been grabbing his ear and seems miserable," or "It really hurts when I swallow." Even if you're not expecting or hinting around for antibiotic prescription, your busy doctor may misread your intent and give you one anyway, all in the name of patient
So
satisfaction.
you gotta tell your doctor to slow down and give you the right medicine
Yeah.
when you're at the doctor.
Tell them you're more important than everybody else.
Yes. Because you are yourself.
Nobody's talking to you, you stupid wall.
Alright, back to where we were done.
Ask about alternatives. If your doctor says, well, let's take a wait and see approach, ask about alternative remedies and be open to trying them. Don't go on a hunt for willing accomplices. If your doctor sends you home with a recipe for chicken soup instead of a Z-Pack, yes, you'll likely find it fairly easy to find another doctor willing to write that script, but resist the urge for a quick fix. See tip number 1. Ask questions. If you're handed an antibiotic prescription, don't leave without having a discussion about what criteria your symptoms meet to warrant the antibiotics, the possible and common side effects, what you should do if you experience a reaction. Be sure you completely understand the doctor's dosing instructions.
So now I say, yes, our next question is
Our wall is now
dead.
dead or something.
Okay, so my question is, so after
Just
hearing,
listen to the question.
so after hearing what and why should antibiotics be prescribed?
What and what? Like
When?
When and why?
definitely not when you're just coughing or sneezing. And when is when you're really sick and you can't take it anymore.
So don't go to the doctor and act like you're really, really sick is what you're saying.
Yes,
When what you have is
unless
just-
you're really, really sick.
Unless you have, when you just have like a cold or something. Okay, so our next question is, do you know the potential side effects to antibiotics?
Nope.
Okay, Blake here can tell you all the stuff that he highlighted
Okay.
green that you can't see.
It's a green screen, you know. Or, I mean, our wall.
Yeah.
Not a green screen. It's totally real. See, now I'm looking over whatever city that is behind us.
That would not be a city, that would be whatever you want to call it. Alright, read the side effects, Miss Bell names are clean.
Okay, so potential side effects include bad rash, bad sore throat, nausea and vomiting, diarrhea, swelling of joints, Stevens-Johnson syndrome, which is a rare skin disorder, most associated with sulfonamides such as Bactrim, retinal detachment, and compromised gut health. Your turn.
After hearing what these do, what do you think about antibiotic side effects?
I think that they're really bad.
So don't use antibiotics, is what you're saying.
Don't use them unless you really, really need to.
Okay. So as you see, antibiotics can surely give you the best of both worlds. So I think
Thanks for coming.
I think that's good. A wall needs to shut up.